cupping, which has gained a decent amount of popularity, or at least press, since the Olympics, and everybody saw those big hickeys on back of the swimmers primarily. And while it can leave bruises, it doesn't have to. And today what I want to talk about is, okay, what is cupping, number one? And then how can it help, number two? And then what are the things that here at Chandler Physical Therapy that we might use that for, and whether that might be pertinent to you or not. So cupping is the use of a vacuum to create a therapeutic benefit. There's lots of different ways to do it. I think traditionally it was done with almost like a glass cup. Fire was applied to inside. The heat creates a vacuum. They pop that cup on somebody. As the heat, it creates that vacuum. It pulls the tissue into it with a vacuum. And nowadays we have modern and maybe a little more safe, as my lawyer might say, techniques. We've got silicone cups on both ends, and then we have plastic cups which have like a manual pump nozzle, which I didn't have immediately on hand. But all of them create a vacuum, and ultimately that's going to be the purpose. How you get that vacuum is going to be a little bit different between each therapist or between different professions. Acupuncturists, I think a lot of times will still resort to what they call fire cupping with the heat and with the glass cups, whereas physical therapists may graduate a little more towards the silicone or the plastic because it's a little more efficacious and easier to use in faster situations. That being said, that's a sweeping generalization. But cupping, whereas soft tissue work, we create compression when we push with our hands, cupping creates a vacuum and pulls away. And so the goal is still going to be affect the fascia. It's still going to affect the skin, the muscle, all that sort of the nerves even, but it's going to affect it in a little different way. It's going to create a vacuum, and that can be very valuable because that can create a fluid shift, and that can really promote circulation. Now, don't get me wrong, grafting, scraping, soft tissue work, it's going to create circulation too, but it's through a different mechanism. With the vacuum, we're getting more of a long-term pull on it, and it's what we call a novel stimulus, which means a new stimulus to the body. And that new stimulus creates an input that the brain has to perceive. And so if you have someone who's been stuck in kind of these painful patterns for long periods of time, new stimuli is important because the brain doesn't know how to react to it, and it forces it to kind of reconcile it. And that's often how we can break some of these kind of chronic pain cycles. With cupping, there's a couple different ways you can do it. We've got the silicone cup, and what you can do is you can get it on, and we usually apply some sort of lotion or cream just to kind of make things glide. You get it on, and you can leave it sitting there, okay? Or what you can do is you can then grab and drag it. And each of it's going to have its different purposes. Kind of letting it sit there is great for kind of low load, kind of static pressure. And just like if someone were to hold on to a tender point and kind of put pressure on it for a long period of time, it helps decrease pain over a long period of time. And that can help in those really, really ramped up patients who maybe are just super, super sensitive and don't tolerate a lot of change. The dragging is phenomenal for fascial and skin mobility, but it's also really good at lymph flow. And if you've ever heard of like lymphedema or lymph nodes, lymph is this kind of this extracellular fluid. Let's say swelling, you can kind of think of it as in our situation. It floats around outside of the cell, and the lymph system takes that extracellular fluid, puts it back into the veins, and then we end up getting rid of it through, normal processes. So if we have extra fluid, and that lymph system's kind of gummed up either because of tight tissue, or maybe it's just not moving because you haven't been able to move. Maybe you've been placed in a boot, or maybe you've been, immobilized for a long period of time. That lymph system requires movement in order to circulate through the body. And so if that's limited in any way, shape, or form, that cupping with the dragging can really help promote that lymph fluid movement and get it moving, and help really decrease some of the swelling, pain that goes along with those situations. And then lastly, we've got this nice little red cup here that can go on through there. And what I like to do with these is a couple twofold. This has a little wider lip, so it's not as good for dragging, but you can get it on. What you can do is kind of manipulate, see if I can get a good angle here, manipulate an angle and kind of twist locally for any sort of local adhesions or restrictions to that. And we can promote blood flow, but also tissue, fascia mobility in that regard. I also like to take this and then have a patient help me out where we can do like an active motion in that area to get that area moving a little bit better. All of these are going to be kind of dependent on the body part and the dysfunction that you're seeing, but they can definitely add and complement to maybe some of the soft tissue work, maybe some of the scraping. And it's, like I said earlier, it's kind of a novel input, so not everybody has felt that. So if you have like kind of chronic pain or pain that's persistent, it teaches your body a new way to move, and that input can help drive better output and overall pain control. So if you guys do have questions, as you well know, you can definitely message us below. You can comment. You can give us a call, 480-786-4969, which I think I should pop up here. Did I do it? Maybe, maybe not. It's kind of laggy on my end. And if you have questions, please fire away. And on that line, we do have discovery visits, which are just half-hour one-on-ones to sit down with a therapist and say, hey, what do I have going on? Is this something physical therapy can help with, or do I need to go somewhere else? Physical therapy can help with. How long can I expect to be treated, and what would you do? So that's what those are for. If you're interested in your local, check it out. But if you guys have any other questions, fire them away, message us, comment, call, email if you got it. And otherwise, we'll catch you on the next one. Have a great day.